With the stretcher shall be the stretcher. Fantastic.
Alright. Okay, when you guys ready? 1, 2, 3. Bring the...
Cindy.
Pick up.
Rachel, please. Just
Pick up.
pick up, guys.
Hold it there. Hold it. Keep it there. No, they'll hold it for you. Now we need someone on the breathing.
He is busy cleaning away the wound. What we're wanting to do is make sure that we're getting away all the dead tissue, so the necrotic tissue that's there, which isn't going to help with healing. So we need to have fresh tissue, what we call granulation tissue, which is the new healing tissue that comes into place. So that's the bright pink colored tissue that we're seeing there, which is really good tissue, is what we want. What she is going to do now is she's going to actually trim the edges of the wound to try and get it fresh edges that can then heal together. I'm going to stitch it together, that we can try to reduce the size of the wound. Wounds can either heal by contraction, where the wounds get smaller as they grow, they're contracting, and then the new tissue grows in. Or you can get, the easiest is what we call primary wound healing, where you're stitching the wound together and you're bringing two clean edges together to heal together, which is obviously the fastest. But if it's dirty, then you're just closing all the bad stuff and then it won't. So closing slowly as it grows slowly by itself, that's called secondary wound healing. Because it's dirty. So because there's a lot of dirt from the environment that comes in, and from the wounds that she got, they were bite wounds, so there's a lot of dirt already in the wounds, bacteria and contaminants in there. So if you close it up, then it all stays inside there and makes an abscess. What also happens is that you get a lot of bruising and crushing of the tissue. So if you've got a nice surgical wound and a selective thing, it's a straight cut through and there's no inflammation or irritation in there, maybe a little bit, but the tissue is around it is clean. With this, the wound tissue is actually crushed from the biting, and that tissue, sometimes the blood supply to that tissue is damaged. And then what can happen is that what looks like a beautiful wound to start with, over time and as you go on over the days of healing, then that tissue you actually discover the blood supply was damaged. And then what happens is then that tissue starts to die off. You get chunks and things of tissue that's actually dead. So sometimes you don't have a choice and you have to do secondary intention healing. Sometimes what you can do is when it looks better inside there and it looks like healthy tissue, if you've got enough skin there, you can stitch it closed. But sometimes the wound is so big that there's so much tension that you just can't get the edges together.